going to be no tanks. There's going to be no infantrymen. There's just going to be autonomous bullets. Buy autonomous bullets against your autonomous bullets. Whichever ones win, the other side just surrenders because it's over. I think that's the second piece of it. I think a third piece that is going to be kind of unexpected is the GLP-1s, which I know you and I privately discussed before. I think these are the most breakthrough drugs since antibiotics. They're probably more important than statins. They're sort of miracle drugs. They seem to, there are downsides, but the downsides and side effects are so minor compared to the upsides beyond just weight loss. They also seem to be addiction breakers. They seem to lower many kinds of cancer. They almost metabolically reverse aging up to a certain point. And I think they're going to bend the curve on healthcare costs. And the big question people are going to be asking over the next 5 years is, why are Americans paying thousands of dollars a month for this when people overseas are getting them for free, or I can order them from China for free or whatever. And maybe like if I were Bernie Sanders, the platform I would be running on is I would say, okay, we're going to pay, hundreds of billions of dollars to Novo and Eli Lilly, and we're just going to make these free. Or there's hundreds of analogs of these things that work. These are not going to be, limited to just the few that are being used today. Just take one of them or two of them and make them free. And I think it'll make a big difference. And as you and I were discussing earlier, this does bend a lot of people out of shape who got there the old-fashioned way, and they want to see obesity as a moral failing on people's parts, and it lowers their status if they are suddenly no longer
the signal is
fit
less
one.
of a signal. Yeah,
Correct.
absolutely.
Yeah.